So let's talk for a moment about what an eating disorder is. What I want to say here is that the slides that I'm going to present to you today and the way that I'm presenting them, these are the ways that I talk to my families or my clients when they come to see me. So whether you are somebody that is going to do CBT for an eating disorder, DBT, or FBT, psychoeducation is the backbone of treatment. It is our job as clinicians to be very skilled, knowledgeable, and adept at weaving in psychoeducation throughout the treatment process. And that's one of the barriers that happens, is that not everybody knows what some of these things are. So when I describe what eating disorders are, I tell people that, well, they're the presence of disturbed eating behavior. So the term eating disorder is meant to describe a number of different eating and feeding disorders, but they're all characterized really by the inability to properly feed oneself, if you think about it. So that's really important. And eating disorders are more than just food and weight and shape. There's characteristic, what we call pathology in the field, but there are temperamental traits, perfectionism, obsessionality, emotion regulation deficits. And there are other things that define what an eating disorder is versus disordered eating, okay? And who develops an eating disorder? Well, anyone can develop an eating disorder. It's one of the things that our research and our clinical work in the field over the last 30, 40 years really hasn't done a great job at looking at diversity. We're starting to more, and most of the research has looked at, Caucasian, mostly women in Western cultures. And so it's very, very important that we check in with ourselves about who we think is going to develop an eating disorder. I know, for example, I talk about this on my team a lot, around the idea that, sometimes when men come into our clinic, it's interesting how it takes a little bit longer for the team to ask questions about eating and eating pathology or weight and shape versus if a woman were to walk in the door. And so we're really trying to be aware and knowledgeable about the fact that anybody can develop an eating disorder, age, etc.